Good evening. Tonight I would like to talk to you about the expansion of the Medicaid and Medicare programs in the state of Oklahoma in an effort to improve the lives of our young children. In his inauguration speech, Governor Stitt made it his goal to increase the educational outcomes for the state of Oklahoma to the top 10 of the states within the nation. Currently, Oklahoma ranks number 41 in educational quality and number 26 in educational efficiency. This is evidenced by the University of Texas at Dallas study, which they used the National Assessment of Education Progress to come to these conclusions. We will not become the top 10 performing or in the top 10 performing schools in the nation simply by assigning more money to school districts. That is not the answer. Legislation has done that in the past. In fact, we did that last year, and the outcomes have not changed since that time. The health care of our children is paramount to the advancement of Oklahoma's educational outcomes. Health and nutrition programs are quite important. They are effective and they improve education and health for our youth. Research indicates that healthy students perform better on academic measures and they have a higher IQ. Have you ever tried to take a test or complete a project or attend a meeting that was of importance when you were hungry? I know I have. I've skipped lunch so that I could get something completed that was important or that was due, and I have experienced that I am not as effective when I am hungry, and that is an overwhelming problem with our students. If you have experienced this yourself, then you already know that that feeling that you have takes your mind off of what it is you're trying to do, rather than thinking about what the person is saying that you're meeting with or focusing and concentrating on the project that you're working on. Your stomach is hurting. You're thinking about eating. And sadly, that is the case for a lot of our students in Oklahoma. Malnutrition can impact your cognitive development because your brain doesn't receive the vitamins and the minerals that it needs in order to fully develop. So these children are losing developmental years as well as not learning the information that they need to learn in the classroom, which of course affects their outcomes. And example of this is stunting, which is low height for your age, or being underweight for your age. These are dangerously common in school-age children, especially in low-income areas. And they've been linked to mental and educational development. So there again, we see evidence that health care is definitely an issue when it comes to education, and it's something that certainly needs to be addressed. Further studies have shown that education increases your ability to earn, and earnings are important. You and I are going to be in a position to retire and receive Social Security benefits and Medicare ourselves one day. And so we need educated people in the workforce making a sustainable wage so that they can pay into the Social Security program So those monies are there for us. I mean, there's got to be money there for us. Currently, Social Security program, according to the website, is fully funded until 2037. Um, but we have to have more income going into that trust fund in order for us to maintain um, our level of Social Security where it is now. Um, and of course, we want those young people to come in and be able to pay into the trust fund so that we ourselves can get our Social Security when it's our time, or our children can receive their Social Security when it's their time. The education for our students is not just important for them, but it's important for all of us, because these children are the futures for us. They are the future of our country, not only in the economic world, but also socially, politically. They're needed. And so we need to ensure that they are properly educated. And in order to be properly educated, we need to make sure that they're healthy and able to be educated. We also know that one's education is important, as it will be a determinant factor in their long range health. Um, People who have more education are more likely to have healthy behaviors, lead healthy lifestyles, receive preventive medication and testing, and thereby um, increasing their lifespan, which is important as we look at our Social Security system. Our lifespans are important. The amount of money that we're able to make in our careers is important. And again, this is not just important for the students currently, but this is important for you and I. The expansion under the Affordable Care Act would extend health insurance to those earning up to 133% of the federal poverty level, which right now is about $33,000 annually for a household of four. So I mean, think about that, $33,000 a year for a household of four people. That is quite low, and understandably at the poverty level. I would even go as far as saying it's below the poverty level, honestly. Um, but 36 other states have already expanded Medicaid and Medicare, and Oklahoma is again fighting this. In June of this year, according to the Associated Press, the Oklahoma High Court rejected the challenge on the Medicaid expansion, and our governor is still opposing this expansion. But while he's opposing the expansion, he wants to increase educational outcomes. So I think it's important that we educate him on the importance of healthcare and education and how those two relate to one another. Um, I want to leave you with some statistics that I found quite alarming in doing my research. Um, One of the things I learned is that 32% of high school students in Oklahoma report feeling sad or hopeless, and so much so that they stop doing normal activities. 41% reported depressive symptoms, excuse me. In the state of Oklahoma, youth ages 12 to 17, 6 in 10 have been diagnosed with major depression and not received treatment. 6 in 10 diagnosed with major depression and not receiving treatment. Not receiving treatment for major depression can lead to suicide. In Oklahoma, 19% of high school students considered attempting suicide. That's compared to 17% nationally. 11% of high school students reported that they attempted suicide at least one or more times during the year. 11%. That's compared to 7% nationally. Last, twice the national average. In Oklahoma, we have twice the national average of attempted suicides resulting in an injury that required medical treatment. Healthcare is important. It's important to education. It's important to sustainability. Please vote yes for the Medicaid and Medicare expansion in the state of Oklahoma.